Should diabetics avoid bananas? It seems to be $1 million question. And there are so many myths which keep on circulating in social media. There is absolutely no problem of eating 1 or 2 bananas every night, even if you're a diabetic. Bananas have tryptophan, and this actually prevents depression and reduces stress levels. It has enough fiber, therefore it is a good medicine with patients who have got constipation. It helps them for easy bowel movement. Therefore banana is not forbidden if you are diabetic, and one of the most important things is to come off that myth whether you can have banana or not. In general, you should remember that if you are diabetic, at least one portion of fruit must be there every day. Now these days you get good quality bananas reasonably priced all around the year, and there are certain seasonal fruits as well. The secret which I am letting you know today, there is no fruit which is forbidden in patients who are diabetics. You can take any seasonal fruit, you can take banana. In fact, American Diabetes Association recommends that you should have at least one portion of vegetables, one portion of bananas at least once a day, and if you keep doing that, you will be absolutely happy. There are so many antioxidants. Because it is a natural food, all these fruits will have so many protective factors, vitamins, minerals, micronutrients, and therefore you must take some fruit or the other. And as I said, you may include banana in your diet. Absolutely, there is no problem. Wherever somebody is diabetic and they have got a high body mass index, or your weight is on the overweight side or obese side, the foremost important thing is not just medicines but lifestyle alterations, which includes regular exercise and making sure that you shed those extra kilograms and come back to your normal shape. Are there any secret formulas for that? No, it's very simple. If you want to reduce your weight, whatever be your age, there are only 2 things you have to do. 1, reduce your caloric intake. 2, increase your calorie output. That means you should be eating, say, only 2 meals a day preferably. First meal you have around 11:30 a.m. Skip your breakfast, forget what goes on social media. Combine your breakfast and lunch and have first meal around 11:30 a.m. 2, second meal is around 7:30 p.m. Don't have anything to have or eat after 7:30 p.m. and don't have anything to eat before 11:30 a.m. So one meal is knocked off. Second, it doesn't mean that because you have knocked off, you will consume whatever you want. No, be sensible. Take lot of vegetable salads or plain rasam before food. It is like a soup, and that will actually reduce your appetite to a certain extent. And both these, that is vegetable salads and simple rasam, will not have too many calories. And after that, chew well, because each time you gulp food, by the time the actual information reaches your brain, already you have tucked in quite a few calories. So chew your food well, and your brain senses and therefore sends early satiety signals, and overall you should make it a habit to chew your food well and swallow and have what we call as mindful eating. With this, you will automatically reduce your caloric intake. Engage in regular exercise. With simple calculation of your height and weight, you will know what is your ideal body mass index. Try to achieve that, as I said, by dieting and exercise. Similarly, there is no exercise which is contraindicated in diabetics. You can pretty much engage in all sorts of exercises. We can classify them as the cardio exercises, where you may walk, you may jog, you may swim, and also you can get on the treadmill. Then the ones to pump up your muscle power, you have to do the weights, and with this combination of cardio and weights, you will be able to get into good shape. You will be able to increase your caloric output, and we already reduced our calorie intake by cutting down our meals to 2. This combination means that you will actually be in a slight negative balance over a period of months to years. You will actually come to the so-called ideal weight. If you are 100 kilograms plus, consult your doctors, and under their guidance, if they suggest, bariatric surgery is definitely worth mentioning, because you need to get to your ideal body weight. If you want to control your diabetes, first thing is you'll have to get your ideal body weight. Come down to ideal body weight. Do not indulge in things like smoking, chewing of tobacco or alcohol. Reduce your non-vegetarian foods to bare minimum and if possible just stop your non-vegetarian food. Again, similarly, dairy products like cheese, etc., you come down in the quantities. Bananas, no problem, you eat them. And as I said, boiled vegetables or vegetable salads and fruits, if you include, engage in regular exercise, you can stay away from diabetes for a long time. That's the best way to prevent these complications. Remember, diabetes kills, and diabetes produces complications in every single organ of the body. So if you don't want to do that, get under the control chart of diabetes, understand that, engage in regular exercise, be happy.